Good afternoon, guys. Let me adjust something and I'll be right with you. Hold on. Adjust something. Okay. Now, today's discussion is about holistic geriatric care, holistic elder care, however you want to label this one, but it's about holistic aging. Okay. Um, so I will get started in a few seconds for y'all. The article comes to us from Alexandria Nolan. Okay, she's the one that wrote this one um, article that I read for you. This is my take on it, so sit back and enjoy, please. The article, Enhancing Daily Living, How Supportive Care Can Make a Difference. Key takeaways. Supportive care improves quality of life. It plays a crucial role in helping seniors and individuals with disabilities live with greater autonomy, dignity, and emotional well being. Personalized care fosters connection. Tailored care solutions go beyond basic assistance by creating meaningful relationships between caregivers and recipients, which helps combat loneliness and depression. Holistic approach to daily living. Integrating services like home care into daily routines empowers individuals and builds a compassionate, care centered community. Emotional and mental health benefits. Supportive care addresses not only physical needs but also emotional and psychological health, which is essential for overall happiness. Foundations of supportive care include includes symptom management and day-to-day support for those with serious illnesses, benefiting both patients and their families. Would you like to explore how these principles could be applied to frailty aware or memory friendly care models? Absolutely. The holistic approach to daily living. Okay. In supportive care refers to comprehensive person-centered strategy that integrates multiple aspects of well-being into everyday routines. Here's a deeper look. Okay, then the other heading is what is a holistic approach to daily living? It's about treating the whole person, not just their medical or physical needs. This includes physical supports, assistance with mobility, hygiene, nutrition, and medication management, emotional and emotional and psychological care, creating space for meaningful interactions, emotional validation, and mental health supports. Social engagement, encouraging participation in community activities, hobbies, and relationships to reduce isolation. Environmental adaptation, designing living spaces that are safe, memory friendly, and supportive of autonomy, like smart housing and sensory friendly layouts. Spiritual and cultural sensitivities, respecting personal beliefs and cultural practices in caregiving routines. Integration into daily routines. Home care is a foundation. Being services, bringing services into the home environment allows individuals to maintain familiarity and independence. Routine personalization. Care plans are tailored to individual preferences, rhythms, and goals, whether that's morning dance therapy or evening mindfulness. Caregiving collaboration. Caregivers become partners in well-being, not just task managers, fostering trust and emotional connection. Why it matters. This approach builds a compassionate, care centered community where individuals feel seen, heard, and supported, not just managed. It's especially powerful in frailty aware and memory friendly models, where subtle environmental and emotional cues can dramatically impact quality of life. Would you like to explore how this could be uh, operationalized in smart housing or adult day care programs? Great question. The holistic approach to caregiving differs from traditional methods in several key ways, especially in how it especially in how especially in how it views the person receiving care and the goals of the caregiving relationship. Com- Comparison: holistic versus traditional caregiving. aspect: traditional caregiving, holistic caregiving. Okay, guys. Focus tasks oriented, e.g., bathing, feeding, medication, whole person centered, physical, emotional, social, spiritual care goals, safety, symptom management, and basic needs, autonomy, dignity, emotional well being, and life satisfaction. Environment, often institutional or standard, personalized, adaptable, um, smart housing, memory friendly design, caregiver role, service provider, partner, advocate, and emotional support, routine design, un- uninformed schedules and procedures, tailored routines based on individuals' preferences and rhythms, mental health integration, often overlooked or secondary, central to care, mindfulness, CBT, social connection. Okay, guys, the difference between traditional caregiving and holistic. In holistic care, they people see the whole person, not just the physical abilities, not just what you can't do, but the whole person. So there's the difference. Cultural and sensitivity, minimal or generalized, deeply integrated into care plans and communication. Why the shift matters. Empowerment over dependency. Holistic care encourages individuals to participate in their own care decisions, fostering a sense of control, reliance, and recovery. By addressing emotional and social needs, holistic care can improve outcomes in areas like concussion recovery or neurodegeneration. Community building, it transfers it transforms caregiving from a transaction transactional service into relational community-based support system. The shift especially impactful in frailty aware and memory friendly environments where subtle changes in routine, design, and emotional engagement can dramatically improve quality of life. Assesses individual needs across physical, emotional, cognitive, and social domains. In, in corporate preferences, cultural views, and life goals into daily routines. Example: a person recovering from a concussion might receive care plan integrating occupational therapy, mindfulness sessions, and sensory friendly lighting. Okay, two, interdisciplinary collaboration. Teams may include nurses, occupational therapists, social workers, psychologists, and spiritual care providers. Shared decision making frameworks ensure that care is coordinated and responsive. Example, in frailty-aware models, input from geriatricians and mobility specialists helps tailor interventions to preserve independence. Three, environmental adaptations, modifying living spaces to support autonomy and safety, especially in memory-friendly housing. Use smart technologies, e.g. ambient assisted living systems, to monitor well-being and support daily tasks. Example, voice-activated reminders for medication, motion-sensitive lighting, or calming design elements for individuals with cognitive decline. Emotional and social engagement. Integrate activities that foster connection, such as group dance therapy, storytelling, or virtual visits with loved ones. Address loneliness and depression through consistent emotional support and community building. Example, adult daycare programs offering culturally responsive group activities and therapeutic art sessions, continuous feedback and adjustment, regular evaluations of care effectiveness and satisfaction, flexibility to adapt routines as health status or preferences evolve. Broader impact. Holistic caregiving doesn't just improve individual outcomes, it reshapes care ecosystems. It encourages dignity, autonomy, and emotional resilience, especially for vulnerable populations like older adults or those with neurodegenerative conditions. Would you like to explore how? Would you like to explore a case study or model that integrates these principles into smart housing or adult daycare environments? Thanks for checking in again, Felicia. Based on both the article and your earlier question, here's a clearer breakdown of how holistic caregiving differs from traditional caregiving approaches. All right. Second half of the presentation, philosophical foundation. Uh, dimension, dimension, traditional caregiving, holistic caregiving. We're going to go into do a comparison of both now. So please join me for the second half of today's presentation. All right. Dimension, traditional caregiving, holistic caregiving. Core philosophy focused on tasks, completion, and safety. Focused on whole person well-being and empowerment. View of the individual patient with needs to be managed. Person with goals, emotions, and autonomy. Caregiver role. Provider of services. Okay, then you got holistic approach. Partner, advocate, and emotional support. Okay. Practical differences. Aspect of traditional caregiving and holistic caregiving. All right, give me 1 second, guys. Daily routine. Standardized, efficiency driven, personalized, rhythm sensitive. Mental health support often minimal or reactive, proactive, and integrated, e.g., mindfulness and CBT. Social connection, secondary to physical care, central to care, e.g., group activities, emotional belonging or bonding. Environmental design, institutional or geriatric, adapted or for memory, mobility, and sensory needs. Technology use, basic monitoring or scheduling, smart systems that enhance autonomy and safety. Cultural sensitivity, often generalized, deeply embedded in care practices. Holistic action, holistic care in action. From the article, holistic caregiving is described as empowering individuals through integrated home care. Holistic caregiving offers a wide range of benefits that go far beyond traditional care models. Drawing from the article, enhance daily living, how supportive care can make a difference, and your own expertise. Here's a comprehensive look at its advantages. Key benefits of holistic caregiving: enhance quality of life, supports autonomy, dignity, and emotional well-being. Encourages individuals to live with purpose and self direction, even in the face of illness or disability. Two, stronger emotional and social connection. Persons Personalized care fosters meaningful relationships between caregivers and recipients, reduces loneliness, depression, and emotional isolation, especially critical in aging populations. Three, comprehensive health health supports, addresses physical, emotional, psychological, and social needs in tandem, which means that when somebody says in tandem, that means together, folks. You know, they put a holistic care, puts takes a look at the whole person, and then puts a care plan together. Making sure that there is enough space in the care plan for everything they need. Okay. Um. Let's see where we were. Comprehensive health support addresses physical, emotional, psychological, and social needs in tandem, improves outcomes in chronic illness, frailty, and cognitive decline by treating the whole person. Empowerment through routine integration embeds care into daily living, allowing individuals to maintain familiar rhythms and environments, promotes independence through adaptive technologies and memory friendly design, family and caregiver well being, reduces caregiver burnout by creating collaborative, emotionally supportive care environments, enhances communication and shared decision making between families and care teams, culturally responsive and ethical care, respects individual values, beliefs, and cultural backgrounds. Builds trust and inclusivity in diverse care settings. Bonus bonus cognitive and neurological benefits for populations dealing with concussion recovery and neurodegeneration or frailty. Holistic care can stimulate neuroplasticity through therapeutic activities like dance, mindfulness, and occupational therapy. It supports collagen integrity and bone health through integrated nutritional strategies. Would you like to dive deeper into how these benefits manifest in smart housing environments or adult daycare programs? Being compassionate, building compassion Right? Building compassionate communities by fostering emotional and social well-being, addressing psychological health alongside physical needs. This approach is especially transformative in frailty aware and memory friendly models, where subtle environmental and emotional cues can dramatically improve quality of life. Would you like to explore how this model could be adapted for a specific population, say older adults with mild cognitive impairment or individuals recovering from brain injury? Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a little bit for B, please, and I'll be back on with you shortly. For now, Gator Wellness, take care, folks.